Maternal mortality in Yemen is still very high.
The rates in Yemen are probably comparable to sub-Saharan Africa.
7 women are dying every day from pregnancy and childbirth. Over 90% of these are preventable.
Which is quite shocking considering when you look at the standard of living, while it's quite low, it's still not comparable to Africa or Asia.
Most of the deaths occurs in the rural area, and this is because of the access to the health facilities. Yemen has demographic distribution very hard, where the 23 million population are distributed in more than 135,000 population settlement. There is a big difference also with the education of women. More than 90% of deaths occur in the illiterate women. This has consequences also to the fertility of women.
سواء ثقافة الزوج أو ثقافة الأم نفسها. أحياناً قد تيجي أم متعلمة يعني ممكن أنها تتابع وتحتاج أنها تتابع الحمل. لكن الزوج أحياناً، لأن الأم أحياناً قد تكون الثقافة مش عارفة خطورة الحمل عليها، مش عارفة ما هو اللي حيواجهها. تقول أمي ولدت وجابت أكثر من طفل، جابت أحياناً 10، أحياناً بعضهم قد يصل ل 15 طفل وما حصل لهاش حاجة.
Most women die after delivery because they didn't reach the services on the right time.
In some areas we don't have midwives, and we need midwives to be trained for this area, because if there is no midwife in a village and there is a pregnant woman, of course she will be in a high risk.
The Responsive Governance Project is addressing maternal mortality by looking at an emergency obstetric care law that would ensure that women do in fact have access to facilities and healthcare professionals that can address complicated deliveries.
The IMOC is a chain of services. It's an emergency obstetric care. It's focused on midwife, it focuses on physicians.
تمام، فضروري نشوف التلفزيون هذا.
And it's focusing also on the building itself. Basic IMOC can provide a normal delivery, counseling, family planning. The comprehensive IMOC, where we can provide cesarean section, blood transfusion.
The cesarean section, which is really a life-saving for a lot of women. And in Yemen, this percent for cesarean section is very low. So we are putting it as a criteria how to increase it. We review all the guidelines and protocols in safe motherhood, and we update it according to the international standards and protocols. And we trainer of trainee in as a national level. And RGB was really one of the main partners in supporting this training.
في عندنا أخذنا دورة الطوارئ التوليدية اللي هي تختص بصحة الأم والطفل، اللي أخذنا بداية بأهداف رعاية الأم الحامل إلى الرضاعة الطبيعية. بصراحة إحنا كان في عندنا معلومات، فتم تنشيط هذه المعلومات من جانب في معلومات جديدة يعني كنا ما أخذناش من قبل.
It's not just a matter of having clinics or establishing clinics. It's more than that. A prevention side should be taken in mind with the community. We have lack of the health staff and female health staff. We encourage community to educate their girls and for them to finish the high school and to allow them to study and in the medical schools and allow them to work in the community. We see a lot of opportunities to work with the community, either outreach, mobile clinic, or private work of midwives. Through our projects with the USAID, we worked with the private midwives in a very rural village where there is no public health facility. A midwife can open her clinic and provide the services to the community. And this should be part of our health system as a national level.
Now we feel that the government is really very interested in supporting midwives. If the midwife is trained well and distributed in all the government, especially the very remote areas, they can save lives, especially women and newborn babies.
I'm optimistic. And we here in Yemen, we should be optimistic in such a situation, because we see a change in our intervention. In Yemen was a big taboo to talk about family planning. And now we can talk about family planning in the TV, in the radio, in the newspaper, talking with communities. We have our decision maker to talk and to advocate for family planning as safe motherhood. So there is a change, and I think if we keep on going on the same at what intervention with our developmental partner did, we have to continue in this to reach a safe motherhood in Yemen.